get out of your comfort zone, because one of the things you realize, there's a lot of people who are more than willing to help.
So it does have a consequence, is
It
something that
does.
I've learned.
To answer your question, all you got to do is ask.
What does the future of medicine look like to you?
As a leader, but even as a clinical person, is you can't be.
Hi, everyone. My name is Irene, and welcome to Oceanside Perspective's new series, Purpose, Why Medicine, where I speak to professionals in healthcare who have found their purpose and want to share their unique journey, experiences, and learnings with our audience. I'm here today with Dr. Byron Scott, who has over 25 years of healthcare leadership experience and clinical experience as a board-certified emergency medicine physician. Dr. Scott is Chief Operating Officer at Direct Relief, a global nonprofit humanitarian medical assistance organization. He is also Vice Chair of the Board for Rady Children's Hospital in San Diego, a leadership professor, and board member for multiple healthcare organizations. Dr. Scott, thank you for taking the time to have this conversation with me today.
Thanks, Irene. Thanks for having me.
So I've provided a very broad overview of your career, and now we want to hear from you about your personal journey to healthcare. Please introduce your background and how you got to where you are today.
Yes. So Byron Scott, and as you mentioned, Irene, a healthcare leader and practiced emergency medicine for over 27 years. And, I was born and raised in Los Angeles. And really, I would look back to some of the roots that, where I am today is probably just an interest and a drive to pursue being a doctor when I was a young boy. Um, and so I would say that's where it began. And then I think it was fostered a little bit more as I was going through, Catholic schools and, in the Los Angeles area growing up. And then obviously went to college, medical school. So, but that was kind of the beginning of the journey. Really, my mom just really putting a real focus on education, and just trying to find a profession or a career one day that I would enjoy, but also you had autonomy. And most of all, she said, where you had options to do many things.
Mm, yeah, I think that's one of the great things about medicine is having so many options as a physician. And we'll definitely speak on that later on in this conversation. So, a central theme for this podcast is purpose or the why behind what you do. So, why medicine and why not any other career?
Yeah, I think for me, why medicine, and there could have been other careers, but I think why medicine is simply the ability to help others, to give back. I think these were things that were, instilled in me as a young boy growing up from my parents, but also, going to, Catholic schools, principles around respect, helping others, things like that. So probably is instilled in me too. So, that was probably the natural progression for me, and why medicine, is that ability to help others and to give back, kind of at the same time. So,
Mhm. Yeah, giving back and serving the community are definitely reasons of why I want to go into medicine as well. Was there a mentor or influential person along your journey who made a significant impact on you?
yeah, I mean, I would say I had many mentors throughout my career. I mean, I would count my mother as mentor number one, the first one. But then I think at different times during my career, I had some just wonderful mentors in college and medical school and residency, and even today. Today, I would say I still have several people that I would call my mentors who I can reach out and, help in things I'm want to still pursue professionally, to give me guidance and things like that. So absolutely. And that's probably one of the things I would say is I wouldn't be here today without mentors. And but I also think it's, when you do have good mentors and you succeed professionally, it's important for you to give back as a mentor and help others along the way in the journey. So,
Mhm. Yeah, mentorship really resonates with me because sometimes it just takes one person to see that potential in you and to change the trajectory of your career and guide you to where you're supposed to be.
yeah, no, absolutely.
What drew you to emergency medicine specifically, and why did you choose to specialize in it?
Yeah, when I started medical school, I had no idea what I wanted to do, in terms of, I would say a specialty, at that time. So it really wasn't until I finished my third year rotations in medical school that I enjoy doing everything. And so at that point in time is when I really started thinking hard about what specialty. And that's, I would say what drew me to emergency medicine. It was the ability to kind of practice different types of medicine, at the same time. Fast pace, always something changing, always something new. But I think it was really the love of just enjoying taking care of pediatric patients, adult patients, doing procedures. I think it was that combination of things that really drew me to emergency medicine.
Mhm. So, as you've shifted your career towards administration, do you miss the hands-on clinical aspect of being a physician?
Oh, absolutely. I mean, I made the decision to kind of leave clinical medicine, about 6 years ago, after practicing for 27 years. So absolutely, there's times I miss it, but my career has taken me in a completely different direction. That I'm doing so many different things now, either in my current role as an executive, as a chief operating officer, whether I'm teaching, whether I'm serving on boards, I still very stay very involved in healthcare and business. So
Mhm. Yeah. So, along with being board certified in emergency medicine, you're also board certified in healthcare quality management and teach quality at the University of Massachusetts Amherst. So, what does quality healthcare mean to you?
yeah, I mean, to me, quality in healthcare really is about improving, desired outcomes for individuals and populations. And so, trying to make sure that the outcomes are the best they can be for, individual patients as it pertains to, to different measures that we measure in medicine. And some of those measures are really around the STEEP framework. Um, and for those that, don't know about STEEP, it was a framework, that was, kind of created in the early 2000s by the Institute of Medicine. It really is about delivering, quality healthcare in six, measures. One, making sure that it's safe, that it's timely, that it's effective, meaning evidence base, that it's efficient, without waste, equitable, and then also patient centered. So those six, aims of quality really, I think create the framework for delivering quality, healthcare.
Mhm. Within those six foundational pillars of quality, how do you measure each one, or how is quality measured in healthcare?
Yeah, I mean, obviously, you've got to be able to collect data because you can't manage what you don't measure. So it's important to make sure that you can capture these data points. And today, a lot of these things are captured in electronic health records, as it pertains to timely things. There's other software tools that may track some of things like length of stay or, issues around patient safety, things like that. But again, it's really about, data, tracking that data, comparing the data to, benchmarks, both local and national. And then, determining, if you're doing well or not doing well, setting up a quality improvement program to kind of make improvements.
Mhm. So, what kind of improvements do you have an example of how healthcare leaders improve quality metrics?
Yeah, so one of them is just something very basic that I think most people can relate to. It has to do with imagining, probably most people have been to emergency department, and like anything in life, we don't like to wait. So in the emergency department, there are certain measures around timeliness. So how long does your entire emergency department stay take? How long does it take to be seen by the physician once you are put in the bed, itself. So those are just one example of, some of the, as I mentioned, time measures, that you may do. Another example would be something around patient satisfaction. During that stay in the emergency department, was the nurse and the physician friendly to you? Did they introduce themselves? Were they courteous? Did they seem to listen? All of these things, help drive the patient experience or patient satisfaction. So that's another, a way things are measured.
Mhm. So receiving that feedback from the patients and then collecting all of that data to see where the improvements can be made and then implementing protocols.
Yep. And then also monitoring, trends, and
Mm,
and in today's world, a lot of reimbursement is tied to actually some of these measures on timeliness and patient satisfaction.
mhm. So, with the way that healthcare systems are structured in the US, how do we balance business requirements and the quality of medical practice when they so often seem to oppose each other?
Yeah, I would say, it's easy because I think there's something called the triple aim that I think makes it pretty easy. So I think if you follow the tenets of the triple aim, you normally won't fall into any, difficulty. It's really about improving, as I mentioned, the experience of care, improving, the health of the population, as I mentioned earlier, improving outcomes and then trying to reduce the cost of healthcare because you know when you're talking about value, you should be trying to figure a way to improve outcomes, but then making sure that you're doing it at the cheapest way possible. And so cheap doesn't mean compromising the care or the quality. You actually want to make sure you're exceeding the quality. So but I think you also have to focus on reducing costs at the same time. But you have to be careful because you don't want to focus on cost too much, and then you're decreasing the outcomes or the quality overall. So
Mhm. Yeah. So, quality management is a lot of balancing different aspects
yes.
of those pillars. So, one fascinating aspect of pursuing a career in medicine is its intersectionality with multiple industries and the variety of potential career paths. In addition to being a physician, what are other possible career paths in healthcare?
Yeah, there's so many. I mean, and that's one of the nice things I would say about, being a physician, and in my case, being an emergency physician, is that there's the opportunity to be a medical director supervising, clinical teams. There's opportunities to work for a health insurance plan. There's opportunities to work for a health and, for a technology company. There's opportunities to work for government agencies or non-government, agencies such as nonprofits. There's just a wide variety of sectors of healthcare that absolutely need, physician, clinical leaders to help, drive the performance of those education of those, organizations and companies.
Mhm. Could you explain what is the role of a physician executive and how is it different from a non-physician leadership position?
Yeah, I mean, I think, so for use this analogy, you can have a CEO, right, of a company or organization. One company, could have a physician executive running it as the CEO. Another company could have a non-physician. Not to say that one is better than the other, but I do believe when you have physician leaders in these roles, especially as it pertains to organizations that are doing, delivery of healthcare, or it's a complex, organization, what they're doing, having a physician who has practiced medicine, who has dealt with patients, kind of has this other unique perspective that, it's hard to, kind of articulate if you haven't done it. So again, I'm not nothing against non, physician leaders, but I do think as it pertains to certain clinical things, being a physician gives you kind of a unique perspective because you can view and think of things a little bit differently because you've done it. And so you understand the potential pitfalls or benefits, that having that unique perspective.
Mhm. So why did you make the decision to shift your career towards administration and become a physician executive?
Yeah, I would say I didn't shift it. I
Mm,
would say was one of after residency, I was one of these, people that, had this dual career from day one. So, when I finished residency, I started my administrative executive career at the same time. I just did both at the same time. My entire 27 years I practiced medicine, it just became more and more administrative, executive, less and less clinical. But I did both at the same time. And then obviously, after 27 years, it became a little bit more difficult to juggle so many things as I got busier. So I would say it wasn't like I chose to do this. It was I kind of did both for years. And there was benefits. I think practicing helped me as an administrator. I think being an administrator sometimes helped me think of things differently from a clinical standpoint. So
mhm. Yeah, I think that interchanging of positions and perspectives is really helpful. So you led three different organizations as a physician executive, specifically a physician practice management company, MCare, a health analytics company, Truven Health, and technology company, IBM Watson Health. In 2016, Truven Health Analytics was acquired by IBM Watson Health, which led to you being Deputy Chief Health Officer at IBM Watson Health. How was that experience for you?
yeah, no, I've been very fortunate to have just some wonderful experiences in different sectors of healthcare. But after spending 18 years in the physician practice management industry, I decided to do something different and work for a health analytics company. And then, we were acquired by, IBM a few years later. And that was just an absolute wonderful experience. It gave me the ability to learn, about technology, to learn about AI in a different way that I didn't know before. So every time I've kind of moved from one sector to the other, I look at it as an opportunity to learn and enhance my skills, but also ways that I can help, others or other organizations. While I was working for IBM, I kind of had two roles. I kind of had a role in one of the consulting groups within IBM where I did international consulting. So I had the ability to travel around the world and see different healthcare systems and help them improve, quality. But then I also had a role of, helping to understand and, AI and, provide, solutions to, potential clients, that would be interested in using it.
Mhm. For those of us who don't know too much about IBM Watson Health, could you provide an overview of what they were working on at that time?
Yeah, back in 2016, IBM decided to kind of venture into, AI and healthcare. They were probably one of the early adopters, at that time they were trying to take, analytic tools, and then try to add, kind of a AI component on top of it, to really improve more, provide better insights for data analytics, to help, kind of, individuals look at things differently than just a simple analytic tool would do. So they, since Truven Health, that was one of the reasons that IBM acquired us, was working in, government sectors, health plan employers, and using their data analytics. They kind of had that data and kind of took AI to kind of apply on top of it to, provide better insight. So that was kind of what Watson Health was doing at the time.
Hmm. And I believe IBM Watson Health, there's still implementations of their technology to this day, whether it's in oncology or in other sectors of health. So definitely um, a pioneer in the field at that time.
Yeah. A lot of the technology, I mean, some of it they sold to the healthcare piece they sold to other companies, but that same technology is still out there in existence. Correct. Yeah.
Mm. So what is your perspective on AI in medicine?
Yeah, what I would tell people, because a lot of people are always afraid of AI and what it is. My perspective is it's here to stay. Embrace it. However, we have to be thoughtful. And one of the things that I always, will teach, try to teach people and say is, when you are trying to solve business problems or healthcare, problems, think of it from the standpoint of you need to have the right people, the right processes, and then putting in the right technology. And one of the things that, I think sometimes people look at AI to do is this, wonderful shiny new toy to help solve all their problems. And one of the things I always tell people, it's like, well, you can put wonderful technology on top of bad processes, and you'll still get a bad process out in the end. So it's important to address making sure you have the right people, working on solving the problem. You have the right processes before you adopt, new technology like AI. So that's one of the things I always caution people, to do.
Mhm. Yeah, absolutely. So next, I'm curious about your experience at Direct Relief, where you've served as part of the leadership team for the past 8 years. Can you tell us about Direct Relief and your role as COO?
Yeah. No, Direct Relief is a humanitarian medical aid organization. And so we've been around 75 years. And primarily, a big part of what we do is disaster relief globally. But we also have a lot of ongoing programs around the world where we provide free pharmaceutical drugs and medical supplies to different, partners we have both in the US and across the globe. And I was fortunate enough, I spent 7.5 years as on the board of Direct Relief, and then about a year ago was asked to help, the organization as the chief operating officer. So it's just been a wonderful experience. Just, you talk about giving back and helping others. The mission, here is just totally aligns with everything I think I've done in healthcare. So it was like the perfect fit, for this time in my career. And like I said, I didn't expect to be the chief operating officer. But when you serve on a board, sometimes you may be asked to step in a senior executive role. So that's one of the things I always caution people about joining a board is you never know, you may be asked to help out if, there's a need at a senior level. So
Mhm. And how has that transition been for you, going from being a board member to being COO?
yeah, no, it's been great. I mean, I kind of miss, being an operator and being in the day to day. Because sometimes when you're serving on boards, you're not necessarily in the day to day weeds of things. As a board, you're kind of more high level oversight. But it's been, a nice change. Stepping in on this level. I still serve on other boards of other organizations, but definitely more hands-on at Direct Relief these days than I was a year ago. So
Mhm. So what do you do as COO on a day-to-day basis?
yeah, so my role here is, I manage 9 direct reports. I have about 65% of the organization reporting up to me, and the big part of what I do is manage our teams everywhere from, you know, donations from pharmaceutical companies that come in here to our programs people figure out where it's going to go, and then we have a warehouse where we distribute these medical supplies and pharmaceutical drugs. We're a licensed distributor in every state in the country, and we send medications in over 100 countries around the globe. But I also have, as a big organization and a highly regulated organization, I also have, human resources and our legal and regulatory team that reports up to me too, because all these various departments have to work together day to day to kind of make things happen in what we do. So,
Mhm. So you're kind of like the conductor of a big symphony.
yes, that's one way to kind of think of it. Yes. You got to make sure that everyone's doing their part, and it's all playing well together. Otherwise, you're going to have problems. It's not going to sound right in the case of a symphony. So, yeah, that's a good
Yeah.
analogy. Yeah.
Besides tuning in, how else can we help support Oceanside Perspective, and how else can our audience give us more encouragement?
If you like our content, we love to produce more for you. But I would say maybe three things. The first thing is really subscribe. If you're on YouTube, please subscribe. And if you're on LinkedIn, please follow us. We are very active on all the social media platforms. So please become our community. I think join us, that's the big thing. Secondly is, if you love us, I'm sure the people surrounded you would like us as well. So please share, please tell more people about what we do, the mission we're trying to achieve across generation again. So everybody is included. This is a very inclusive community. So please share and tell other people about Oceanside Perspective. The third thing, I think, come back to resources. I would really appreciate if you would consider that to donate to our cause for a great mission and for more content that we're going to create and benefit our community.
All right. Thank you so much for joining us today, Helen, and for talking to all of our Oceanside Perspective community.
Do you have a story or experience to share where you and your team at Direct Relief made a significant impact?
Yeah, I mean, there's so many, because as you can imagine, we ship out about 24,000 shipments a year to 100 countries and 50 states and over 3,000 organizations. So there's so many stories, but, just trying to reflect this year, I was able to travel with some colleagues to Jamaica back in May. And as you know, the islands in the Caribbean, sometimes get hit hard every year from hurricanes. And so Jamaica got hit pretty hard in some previous years. And, we were fortunate enough to have a lot of people give us money to donate and help, make these countries, ministries of help more resilient. So I was able to kind of go to Jamaica back in May and tour the island, tour the healthcare system, understand their challenges and their needs. And it also gives you just kind of a real appreciation of when you live in the U.S., what we have, especially this healthcare system. We complain, but when you go travel abroad, you get a different perspective, and it makes you appreciate what you have, that much more. But the one of the things that's always rewarding is being able to, we provided them a grant to help the national health system and their pharmacy become resilient. So that grant was going to be used for solar power, which on an island nation is a big deal because of the cost to, keep a pharmacy, a large pharmacy warehouse, at the appropriate temperatures, to run air conditioning on solar versus, non-solar. It's like night and day. So we provided a grant, which is going to make that island more resilient. So.
Yeah, thank you for sharing. I'm sure there's so many stories that you could tell from your time at Direct Relief, and it's really inspirational to hear all of the impact that you guys are doing. So thinking back to your why from when you first decided to pursue medicine and your why now, do you think your purpose has evolved over time?
No, I think it's still the same, just different. I would say it's still, helping others. It's still giving back. And in this case, I'm very hands-on with what I do, just a little bit differently, and not touching patients, but I'm, helping to support organizations that are directly supporting patients. So I would say it's very similar, just in a different way.
Yeah. Let's talk about leadership, since you have a very unique perspective and vantage point, having been physician executive for multiple organizations and now COO for Direct Relief. What is the general leadership structure of healthcare organizations?
Yeah, I mean, when you look at leadership in organizations, I think people always have to remember it starts at the top. And the top, what people always want to think it's the CEO or, the C-suite, but it always is the board, because the CEO reports to the board. So, most healthcare systems, the top tier is the board, then there's the CEO, then there's the senior leadership team under that, and then multiple layers of leaders under that. So that's kind of the typical hierarchy in most companies or organizations when you look at, leadership and how things are kind of done. But then obviously, if you're talking about healthcare, if it's a hospital, then you may have, clinical leaders in some of those leadership roles. You may have nurses, you may have pharmacists, physicians, and so on.
Mhm. How do these leaders' decisions affect the rest of the organization?
Yeah, a tremendous amount of impact because I mean, they're driving the ship, they're making the decisions, the teams are reporting up to them, so they have a huge influence on what happens day to day. And as a leader, it's very important to make sure that have a very, a team focus and the ability to bring, people together, to work together, to communicate, to support, kind of a common mission or goal. So it's very important as a leader to be able to kind of bring people together, to work together. Again, we'll use your analogy like a simply, healthcare leader has to be like the conductor, of his teams and making sure they're all, kind of working together in the same way.
Mhm. So, as vice chair of the board at Rady Children's Hospital in San Diego and board member for multiple organizations, what are your roles and responsibilities?
Yeah, as a board member of healthcare organizations, I mean, there's, obviously there's the fiduciary responsibility you have to making sure that, the organization is, accomplishing its mission responsibly, following all, legal and regulatory, issues. As a board member, another big part of your job is to actually help support the CEO and the management team. It's not just about, you're their boss. It's really about you're there to help them succeed. And so, what I try to do and what I try to do at Rady's, as a board member and, as vice chair of the board is really to partner with the CEO to lend my expertise to be a sounding board, to help challenge the team when, I think there's maybe consider doing something differently. I don't tell them what to do, but, at least be there to kind of help them, guide them, give them, suggestions. So, so that's where I look at, just what an effective board member is and kind of what I do and what most board members, kind of are there to do is really to help the management team.
Yeah. And so the board members all bring different areas of expertise. So what are you advising on quality or what aspect of the board? Sorry.
Yeah, I would say,
Yeah.
I think it's an excellent point to raise is that boards usually have a diverse background of individuals that bring different unique skill sets. And so from my perspective, I bring, I think, many things to the table. I bring my clinical perspective as a physician who practiced medicine. I've also been as a physician leader and executive for different types of healthcare organizations. So I bring that perspective. I've also, in my experience, working in technology and health analytics company, I sometimes am very helpful as it pertains to things around IT or AI, conversations we're having in different organizations. But then just, having, different roles where I've had financial responsibility, where I had to manage, the profit loss of an organization. I bring kind of a financial perspective and operations perspective in some of the roles. So I kind of bring multiple things, from, my background, besides obviously quality too is another, skill set that I have.
Mhm. So how important is diversity on the board or in leadership in a healthcare organization?
Yeah, it's extremely important, and diversity is not just, always, ethnic diversity. I mean, diversity is about diversity of skills and perspectives. Now, it does help if you come from different backgrounds because when you work in a hospital or a health system, you're treating all comers, all different types of patients. So having, leaders or, a board that, has different diverse perspectives or backgrounds, experiences, really is going to help any organization or company, accomplish, their mission. So I think it's very important to have, different perspectives. And that also goes from gender perspectives. I mean, you can't just have an all male perspective or an all female. It's important to have both and making sure that you have all of those at the table to really understand because, half of the patient population is female and half of it's male. So you need to have all those perspectives, really if you're going to, accomplish, especially deliver quality healthcare.
Mhm. So in a sense, the board should be representative of the population.
Yeah, ideally, in a perfect world, that would always, I think, or, I would say the population, the community, right? So if you have a board that's serving whatever their community and population is, having that, representation, is absolutely beneficial and helpful.
Mm. So what is your leadership style and how do you like to lead your teams within an organization?
Yeah, I would describe my style as more of a collaborative style where I try to bring people together. I also believe in empowering, my leaders and my teams to make decisions. I try to teach them this is your book of business, this is your expertise, and you own it. I'm there to, I can always make the easy decision, the quick decision, but I want to be there to help support you in any way possible. So, I, delegate authority and let my teams run things, but, making sure that they communicate with me and keep me up to date on, issues or problems. I think most leaders don't like surprises. So one of the things I've always tried to do is just, even myself, if there's something that's kind of just not right, making sure that I would communicate things, to others. And so I kind of expect that from my team, and they typically, always do that. So,
Mhm. Yeah, so communication is definitely an important quality to have as leader. What other important qualities do you think are that a leader needs?
to listen is very important. Mistakes sometimes leaders make is you're too much one-sided talking. I think you need to make sure that you listen as a leader to understand, your people, your teams, and what the issues are before you kind of, make decisions or do something. So listening is an absolutely, an important quality. And I think also, as you mentioned, communicating, things, but also having trust. You have to trust your teams, and your teams need to know you trust them. So that I think is another important quality, I think for leaders.
Mm. So how do you foster trust within your team?
I think it starts with communication, a two-way. I think, if you're communicating, both ways effectively, then typically people understand, what's going on. I think as a leader, it's important to make sure you delegate, because if you truly delegate and you're not micromanaging, people will feel comfortable, and that's what creates, trust. So that's kind of, a way I do it, and which I think is important.
Mhm. How important do you think authenticity is in leadership?
Yeah, I mean, I think it's very important. You have to be, your true, self. I mean, people need to know what to expect of you, and know who you are, and your perspective. And, you can't say one thing and do another. You have to lead by example. So kind of gets into that whole concept of being truly authentic, you are who you are, and, you portray that in everything you do, everything you say.
Mhm. So what does it take to be an effective leader in the healthcare industry?
Um, I think as I mentioned before, I think it takes a lot of patience. You know, absolutely you have to, be a great listener. And then, sometimes you have to make tough decisions. So you can't be afraid to do them when they have to be done. One of the worst things I think, even as a leader, but even as a clinical person, is you can't be hesitant. You have to, sometimes it requires making a decision. Some of the worst things people can do is inaction, not doing anything, which can create a whole other host of problems. So it's very important that if something needs a decision or an action done, you have to be able to kind of make that decision.
Yeah, absolutely. Sometimes inaction is also an action.
Yeah,
So it does have a consequence. It's
it
something that
does.
I've learned. Yeah. So why do you think it's important for doctors to also be in executive and leadership positions?
Yeah, for me, I mean, it's kind of, I think, natural, but I think it's just very important if we're going to make changes in our healthcare system in this country. I truly believe that we need to have, adequate representation of clinical and physician leaders, on the boards, on the C-suite level, driving these changes, because, being a physician just, gives you a very unique perspective that non-physicians, don't have. And again, it's no disrespect against non-clinical leaders, but it definitely is an advantage. After I look at my career, after probably taking care of more than 50,000 patients during my career and having that many touch points, it gives me a unique advantage, space when it comes to things about patient experience, or things about, making decisions, whether you need to figure ways to reduce throughput time in the emergency department. Once you've done it and been impacted by it, you have just a unique perspective that you can't teach, someone who's never done it.
Mhm. So similar to the board conversation, it's just bringing that diversity, the physician's perspective into leadership is always beneficial.
Yeah.
Great. So speaking about the future of medicine, what does the future of medicine look like to you?
Yeah, as you know, our healthcare system is very complex. We have a lot of challenges and opportunities to make things better. I think, we have to find solutions to make healthcare more accessible, more equitable for everyone, in the country. Because at the end of the day, if we don't figure ways to help people that, have more challenges accessing healthcare, we're all going to be impacted by it in some way. So I think it's very important to, realize that, we talk about social determinants of health, kind of where you're born, where you're raised, can set up kind of a whole trajectory of things, what happens in your whole life when it pertains to healthcare. So it's very important to, figure ways to make sure that we're providing that equal opportunity for everyone to be as healthy as they can be. And so that's, when I look at what our big challenges are, is figuring solutions, to that. So.
Mhm. Yeah, I think it's such a broad um, industry, and there's so many little ways that we can help. So we just each make our own little impact, and hopefully that will add up to making
Yes.
a big change.
No, I agree.
Yeah. So, what advice do you have for aspiring physicians who want to make an impact?
Yeah, I would say, for aspiring physicians, it's important to, I think, make sure that, you choose a specialty that you are going to enjoy, the rest of your life. Be the best that you can be. It's very important to, I think, to be the best clinician you can, because, if you want to be, I think, a healthcare leader, healthcare executive, you also need to be a very successful clinical leader, because, one, it gives you additional credibility with people when you're trying to lead teams. So if you are, practicing good medicine, sound medicine, and people know that, it gives you credibility as a leader. So it's very important. I try to, tell medical students and residents, make sure that, you develop your skills and, as a clinical leader, if you want to be, physician leader, or healthcare leader in another capacity.
So you mentioned in a previous conversation that you've maintained your board certification as emergency medicine physician. What other ways would you recommend upskilling or maintaining that credibility?
Yeah, I think there's many things. As you mentioned earlier, even though I stopped practicing, clinical medicine over 6 years ago, I still maintain my license and my board certification. And it's just important to give it credibility, but I think also, aspiring to achieve other certifications and expertise. So in this case, as you mentioned earlier, I have a certification in healthcare quality that I obtained over 25 years ago and I maintain. And so there's so many different things that, physicians or other leaders can do. It could be as simple as obtaining a qualification or a certification in Lean Six Sigma and quality improvement techniques. So I think it's a matter of what your passion, your interests, and then develop those additional skill sets and expertise, to kind of, be a leader in the healthcare system.
Mhm. Yeah, definitely a lifelong learning journey is important.
Yes.
Okay. So during this conversation, we've reflected on the past with your journey to medicine, the present with your experience as a physician executive, and the future where healthcare and its leadership will continue to develop. As this interview comes to a close, I have one last question for you. If you could, what's something that you'd like to tell your younger self?
Yeah, it's a great question. One of the things I will say, because when I was going through college and medical school, I was a little bit shy and quiet. I would tell my younger self, it's like, ask more questions, don't be afraid to ask questions to people. Get out of your comfort zone because one of the things you realize there's a lot of people are more than willing to help, to answer your question. All you got to do is ask. So definitely one of the things I would say to my younger self to do differently. Outside of that, I'm not sure I would tell him to do anything else. I think I would have still done, went to the same colleges, medical school, same specialty. I don't think I would tell myself to do anything differently, but I would definitely say, don't be shy, ask questions, and, early in my career, so.
Yeah, I think that's advice that I need to hear as well. I tend to be pretty reserved, and this podcast series is actually my way of stepping out of my comfort zone and asking the questions that I want to ask. So, thank you for being a part of it.
Yeah, no, thank you for the opportunity.
So, again, thank you for taking the time to do this interview, Dr. Scott. I've learned so much about what it takes to be a great leader in healthcare, and I wish you all the best with direct relief and beyond.
Yep, thanks, Irene, and wish you the best, also.